Okay, so I've got this burning question that I have to ask the doctor. My wife and I recently saw a movie about medications, and specifically medications for ADHD, and the one that was really talked about the most was Adderall and its negative effects. In your practice, do you see an abuse of the medication? Do you see that there's times where maybe somebody doesn't need medication, they just need modification of behaviors? When do you know if, the will or the pill is the chapter that we write about? Is it the will, or are you looking to find the right pill? How do you determine that?
Boy, that is a tough question. I am sure that you can abuse Adderall. Mm-hmm. I am sure you can do it. But that's not the same as taking it as directed and getting a good outcome. People can take it by the handful, sniff it, snort it, inject it. I don't know what people do. I honestly don't. But really, when taken as directed, it is not very addictive. It's got a label that the FDA says may be addictive, but people are very worried about the addiction while they're sitting there sucking down their coffee. So everything in life, or nothing in life is free, right? So when taken as directed, many people go on it for the weekdays, off it for the weekends, on it for school days, off it for Christmas break, and they're not in withdrawal. So if you take it as directed, then hopefully you get the benefits of it. Addiction is one of the things I worry about the least. Adderall and all the other medications, they are not M&Ms, so they can have side effects. If you put something in your body that goes up to your brain to work, it can have negative side effects. And those can be things like worse sleep, worse appetite, worse mood. Those would probably be the top 3. Adderall isn't worse than any other drug. It gets talked about a lot. Mm-hmm. It's been around for a long time, and it's covered by insurance pretty well. So a lot of people are on Adderall as compared to other things. Mm-hmm. However, they're all very similar. People are always asking me, what is the one medication that's going to work the best with the fewest side effects? And I couldn't tell you. Everyone has different brain chemistry. So if there was just one medicine that worked the best and had no side effects, my job would be easy, because I'd be like, here, take that one, take that one, take that one, same one over and over. But everyone's got different side effects. I think the important thing is, deciding when you want to cross that line of taking a pill for your behavior. And that's something that comes up, when you're anxious or depressed or other types of not just in ADHD.
Right.
So, I think that this is also a question that society has to answer, because, is it okay to take pills to make you better when you're already pretty darn good? Mm-hmm. That's a big question that has to be answered. I mean, in athletics, right, they're testing for all sorts of things that take somebody who's an athlete and make them a better athlete. Is that okay, or is that not okay? Mm-hmm. And I've definitely had people come up to me and say, well, I'm pretty good, but I know if I took X, I'd be excellent. I'd be much better. Adderall and the other medications, they help a lot of people focus. You don't just have to have ADHD. They ask many students, they're cranking them for studying. Or is it the right thing to do just to take them if you're down here, if you have a disability and need to level the playing field? I think, these are tough questions to answer.